Alright, so we're dealing with a patient who has three symptoms. We got pyomyositis, calcific tendonitis, and dactylitis here.
So what diagnosis do you all think it could be?
Well, from what I can gather, the pyomyositis seems to indicate inflammation of skeletal muscle, while the other two point towards some sort of joint issue.
I agree with Leslie, but I also believe that we need to consider more than just these symptoms. The dactylitis could suggest a bone disease or a metabolic problem too.
Yeah, Randall's right about that. But what if the pyomyositis is not an inflammation, rather an issue of the muscles themselves? We should consider all possibilities before arriving at any conclusion.
Alright guys, I understand your concerns, but my gut tells me it's dense disease. Don't worry too much about these symptoms, just do what you need to do. And that means we'll have to perform a Wertheim Meeks operation on this patient.
Dr. Hawks, aren't you being a bit hasty? We still haven't discussed all the possibilities in detail.
That's right, Leslie. Maybe there's another way to treat this patient that doesn't involve such a risky procedure.
I think we need more information before making such a critical decision. Let's not rush things.
Okay, fine. We'll take our time and investigate further, but if I'm right, then it will be dense disease, and the Wertheim Meeks operation is what needs to be done. Alright, I've got it. Let's do a Wertheim Meeks operation on my patient with dense disease.
Hold up there, Hawks. Where did you get such an idea?
Some crackpot school principal with poor cooking skills.
I'm not falling for that one again. Where did you really get this stupid idea?
It was Dr. Frank's idea. He's lately been bringing up a lot of good ones, and I think he's onto something.
That's quite the turnaround from you, Hawks.
Yes, and that's why we're doing the operation.
What's he gonna say if this goes wrong?
Oh, what the actual fuck? How could this have gone so damn wrong?
This is a critical situation, Frank. The Wertheim Meeks operation was not the right treatment for dense disease, as you pointed out.
I know. And that dipshit boss of ours passed the idea on to Tracy as if it was my idea.
Hey, he does that sometimes. Tracy knows Hawks is lying.
Yes, but I'm genuinely tired of it.
So do something about it. You've complained for years about mistreatment, only to never actually do anything worthwhile.
That changes today.
What about the patient?
You know more about this job than I do. They'll be fine.
You nearly killed her. How could you have possibly misdiagnosed dense disease and chosen the wrong treatment? I'm shocked, absolutely shocked.
We're sorry, Dr. Hawks. We genuinely thought we were on the right track with the Wertheim Meeks operation.
The patient's symptoms had been consistent with dense disease, and the surgical procedures seemed appropriate for her condition.
Well, your appropriate decision nearly cost that woman her life. I expected more from you, especially after our long hours together in the hospital. It's a shame to see such a promising team stumble this way.
I'll cut the shit, Hawks. You just want to blame all of us for this turn of events because you insisted on the wrong treatment and diagnosis. Par for the course, I must say.
Excuse me?
No, I'm done excusing you. The past week, I've had a change of heart.
Oh, did you have some makeout session with John the Baptist? I'm not surprised you'd be attracted to someone even more useless.
Shut up. It was bad enough you treated Gary like this, but now that he's out of the picture, I'm your favorite scapegoat.
What?
I may have gone too far. I'm sorry about that.
Who the hell is Gary?
I meant Randall. I thought his first name was Gary. Just forget it. I'm done. I've applied to work as a surgeon from now on, because at least there I can find doctors who can competently lead by example. You're a disgrace to the medical profession.
That's so rich coming from you. You won't last long. I give it a few weeks until one of the surgeons decides to pull a funny prank on you and makes you perform your own lobotomy. You will then walk around acting momentarily confused, then continue on with your life like the operation made no difference. And not a single person will be surprised.
Fuck you, Hawks.
You've been awful quiet today.
Frank quit. The chaos is gone, and I realize I'm probably going to miss it a bit.
I thought you would be celebrating a day like today.
I would. He didn't mention he was going to become a surgeon in the same hospital. Now it's far harder to blame my own team for their screw-ups with one less bozo.
How is that supposed to work?
I don't know. I hate change. And now I've lost Frank.
Don't Leslie and Randall at least know what they're doing?
Sometimes, but they both piss me off in a different way.
Frank's shoes are big to fill, and I don't know another clown that would fit there just yet.
Didn't you have some patient a while ago who you said was caught up on the lore of the hospital? Someone who seemed like a natural fit?
Wait, I forgot about them. I've had their numerous rejected job application forms in my desk for a long time now. For once, Johnson, you may have saved me.
What about the patient?
They're a doctor, and they can help fill Frank's shoes perfectly.
No, I'm talking about the patient you and your team treated this morning.
God damn it, I hope they died already. I don't want my momentum of thought to die on something that trivial. Kidding. I'll take care of that. Alright, everyone. Let's calm down. I've got a new diagnosis for dense disease here.
Excuse me, dense disease was wrong.
What do you mean it was wrong? We spent years researching this condition.
Listen to me. I'm telling you all now. Dense disease is not the right diagnosis for our patient. The real cause is progressive symmetric erythrodermia.
And what makes you so sure it's that, Hawks?
We've been following a different path here. How can you just change everything without proper evidence?
Frank was wrong about the case this whole time. Anyway, the prognosis for progressive symmetric erythrodermia is quite simple. It's treatable with a combination of diet and medication. Now, excuse me, I have an interview to conduct after Tracy rips me a new one.
Oh my god! Frank just up and quit?
Yeah, I don't think anyone saw that coming. At least not into the middle of a season.
So I have 3 applicants I would like for you to review to fill that position.
If none of them are the one I already want to hire, I'm not interested.
Hawks! We need to be fair with the hiring process. Set up the interviews and ask the same question to each one.
We are an equal opportunity employer. We believe that laughter is the best medicine, so you must tell us your best joke. There are no limits.
Oh my god, I can't believe this is finally happening.
You sound way different than you did on our last call.
About that. I had a medical emergency a few months ago due to an occupational accident, and it's permanently scarred my voice. Don't accidentally set a fire in a locked room.
Things have been interesting.
Since you're mostly caught up on the lore, Frank quit for whatever reason, and my remaining 2 doctors are boring as shit. I want someone competent who can take on challenging cases and be interesting.
For the joke, you said there's no limits?
No limits. This interview that's just between us is a free speech platform to express the best ideas you have in humor.
So a father, mother, son, daughter, and dog walk into a talent agency.
Okay, I was not expecting an aristocrat's joke. You're a goddamn overachiever. You start Monday?